Yeah, a very good evening, students. Let me check. Yes, let me check so that it works. Yes, let me check. Yeah, it's working. I'm audible also. Yeah. So, a very good evening, students. So, today what we'll be doing, we'll be trying to, have a discussion on management and its different techniques. So, we have 40 minutes. We'll try to have a proper understanding on management and the different techniques which are involved in management. I know this topic is, it's quite interesting, and if we understand in the best possible way, this help us to, use this management techniques in our day-to-day life also. Yes, so very good evening to everyone. So, uh, this is the special classes which I am taking. I am taking tomorrow in the morning. We have a class on nutrition, previous year's questions, primarily focusing NEET PG and other exams. And day after tomorrow, I have a class at the same time on demography and family planning students. Okay, so today's session is basically revolving around, it will revolve around management. Now, try to understand this management. You know, in every day to day life, we are involved in doing management and we use this word so frequently. So, the management has to be done, the management is doing this, the management is doing that. So what is this management? We have to understand this management in best possible way. So, in a simple line, if I have to say, students, what is management? It is the art or science of achieving goal through people. No, if you have a goal and if you want to achieve this goal, if you're achieving through the people with the help of people, so you're achieving this goal, you're accomplishing this goal through with the help of people, with the support of people. So you're getting the people work. No, you're getting the people work done. So that is management. If it is that you have to do the work, that is easy. I'll do, not a problem. But if I have to get the work done by different people, then it's not easy because every people is different. Every people means qualification is different, their temperament is different. So the work done by those people, and if you are a manager and you're trying to get the work done through those people, it's not that easy. So if you're able to get the work done through those people, that is management, right? So it is an art or science. So you are basically what you're doing, you are coordinating the efforts of people, right? And when you are coordinating the efforts of people, students, why are you coordinating the efforts of people? Because you want to accomplish goals and objectives. So whatever goals and objective you have designed or you have desired or you are envisaged, you are trying to coordinate the work, the effort of the people to accomplish goal and objective, and you want to utilize all the resources which you have in the effective and efficient manner. So you are transforming resources to utility. So that is called management, right? So in simple sense, students, it is an art or science of getting the work done to accomplish goals and objective by using the resources in an efficient and effective way through the people. You cannot do alone. You have to get the support of the people. So that is basically management, students, right? So if you see, whenever we use this topic management, there are 5 to 6 words you will always use. Coordinating, I am coordinating the things, I am organizing the things, I am planning the things, I am forecasting, controlling, commanding. So all these words is very common which we use on day-to-day practice whenever we are talking about management. You must have used, no? I am coordinating the activity, I am organizing the activity, I am planning the activity. So forecasting it, controlling it, commanding it. So all these things are, students, common words generally used in management. But there is a slight difference between planning and management. Planning is for tomorrow. No, I am doing certain planning for tomorrow, day after tomorrow, whatever, for future. Management is for day-to-day activities. You are trying to get the work done or trying to manage the things on day-to-day basis. So management is for today, planning is for tomorrow. So this is the best way of understanding the difference between management and planning. Now, with regard to health management techniques, so we have the health management techniques is divided into two parts. First is behavioral science and second is quantitative method, students. Please try to learn this, please try to understand this, because I'll tell you in NEET PG 2020 we had one question from this table which I have given here. And before that also there are one or two questions asked on this table. So if I say what are the behavioral science management technique, it is organizational design, it is personal management, communication, information system, and MBO, which is management by objective. And there are quantitative methods where quantity is involved, cost benefit, cost effective, cost accounting, input output, model, system analysis, network analysis, PPBS. We'll talk in detail all this, work sampling and decision making. So what I'm trying to say, which all health management technique is a part of behavioral science, which all health management technique is a part of quantitative methods. So where quantity is involved, that for example, cost, benefit, cost effective, input, output, cost accounting, model, system analysis, network analysis, planning, programming, budget system, work sampling, decision making, all are quantitative methods. Behavioral science, based on the behavior pattern, if you're doing certain management technique, that is organizational design, personal management, communication, information, and management by objective. So this table I'll just show you two questions on this. So this was the question asked in NEET PG 2020. Now what is this NEET question, students? All of the following are included in methods based on behavioral science, except which one management method which is mentioned here in the option is not a part of behavioral science. So just now we have read personal management is a part of behavioral science, management by objective is a part of behavioral science, communication is a part of behavioral science, system analysis, students, just now we have talked, it is a part of quantitative methods of management technique. So this, I'll just go back. If you see this slide, behavioral science and quantitative methods, just by enumerating the different types of management technique with regard to behavioral science or with regard to quantitative methods, it helps us to solve the question, right? So here the answer is system analysis. This is quantitative method. This is not behavioral science. Okay. Let's take the second question. Which of the following is a technique or method based on behavioral science? Now they are asking you about among the options given, which one belongs to the behavioral science technique. So management by optic, yes, this is correct. Network analysis, no. System analysis, no. Decision making, no. So my answer goes management by objective. So just by differentiating or just by enumerating different techniques based on behavioral science, based on quantitative methods, we are able to solve the questions, right? Okay, let's try to understand now different management techniques. So first we'll try to understand behavioral science. Student, as the word goes, behavioral science. So the first is organization design. You know the organization, wherever you are working. Suppose I am working in an organization, WHO, UNICEF, JHPIEGO, UNFPA, UNOPS, UNDP. So there are different international, I'm naming all those international health organizations. Why? Because they are organization. So it is the theory of management. No, you can think in that way. The organization must be suited to its current situation. Now, currently, take an example. COVID is going on. Whenever you're working in an organization and we had to participate in any meeting, what used to happen? We used to go to a meeting, a conference room, everybody used to sit there, we used to discuss and go. Now, what has happened? Since COVID, nobody's moving, everyone is doing virtual meeting, virtual trainings and all those. So the organization must be suited to its current situation and needs to be serviced. So the organization design should be reviewed every few years because there is a changing concept, there is a changing purpose, problem keeps on changing, technology also keeps on changing. So the design of the organization should be reviewed on a regular basis, and it should be very much in line with the changing concept, problem and technology. So this is your organization design. The second one is personal management. Students, the best line of explaining this, if you understand this, the entire thing becomes easy. Skillful use of human resource. Suppose you're very skilled in one of the thing. For example, I say you're very skilled driver, right? So I very skillful driver. So if I am a very skillful driver, so I'll be using my skills to train people. So if I am suited, if I'm a very skillful driver, I have this skill, I will be imparting this skill to others also. I am a skillful driver and you are making me to do work of, for example, computer data assistant. I cannot do. I'm not skilled here. I'm skilled in this. You're putting me here. So it is very important, students, the management, how we utilize the human resource with the skills they have. I am specialized in community medicine. If I am being told to teach anatomy, I cannot do that. I'll not be doing justice. So skillful use of human resource, that is management. So whenever you are, so how do you ensure that the human resource gets best utilized is by proper method of selection. Why should I hire a person who is skilled in driving for data science or data assistant? No, I should not. So there should be a proper method of selection, training, motivation, division of responsibility of work, distribution of roles, incentive for better work. No, there should be always opportunity for promotions and professional advancement. So all these things which is there, what it ultimately is trying to focus on. It is trying to focus on how well can we retain the human resource first, and how best can we utilize those human resources. So again, this is behavioral science and it is personal management. Now come to the communication. Without effective communication, you cannot work. Now, if I don't communicate properly, if I'm not able to communicate what I want to communicate, you will not understand. Simple logic. So, in the management has to take care, the health management has to take care of communication problems by ensuring that we have good, suitable vertical connection. Vertical connection means somebody is above, somebody is below. So I am at one place, my position is I am reporting to someone else, someone is reporting to me. So this is verticals. And horizontals, my all colleagues which is working at par with me. So if I have a good communication, both vertically and horizontally, so that is also behavioral science. Now come to information system. If you don't have proper information, how will you do day-to-day management? If I don't have, for example, every day you see, if you go to the government website, let's take Ministry of Health and Family Welfare now. So if you go to the website, you see COVID status now. How many cases, how many deaths, how many recovery, how many people are active. So this information is there on day-to-day basis. So that information is required to manage the system. Unless until you don't have the information, how will you manage it? So information has to be provided on a consistent and regular basis to manage the health system. It can be informal information, informal also. And information, whatever information you want, that depends upon what health services you are trying to manage it. So that information system can be twisted, tweaked, tailored according to the management need of health services. For example, I am trying to manage a health service, for example, maternal health services. So, and I want information system with regard to maternal health. So, I will be tweaking, I will be twisting or tailoring it according to the need. So ultimately information system consists what, students? Collection, classification, transmission, storage, retrieval, transmission, display of information. So all these are a part of information system. So this is also a behavioral science. Good evening Avinash, good evening Prachi, good evening Meena. Yeah, the last one is management by objective. Now objective. So let's try to understand MBO. This is also important. So management by objective is a process. First of all, let's define the objective within the organization. So if I am attached with an academy. So what is the objective for me? I have to teach the subject which is community medicine, so that student understand to the best of it. So that is an objective. So it's a process of defining objective within the organization. So the management and employees agree to the objective. So Unacademy and I am in agreement that I'll be teaching this subject, so that is the objective which the organization has, and I am abiding by that, and I'm trying to perform in such a way that the objective is achieved. So there is a specific objective. So whenever there is a management going on based on objective, that is called MBO. Simple, right? Now, so all those which we have discussed as of now: organizational design, personal management, information system, communication, and management by objective, all those are behavioral science. Now we'll start talking about quantitative methods, and please try to understand this quantitative methods. It's very simple. We have to make your concept. The first is cost benefit analysis. You must have heard. What is the cost benefit analysis? What is cost effective analysis? What is cost accounting? So let's try to understand this. Let's take the first one, cost benefit analysis. Now let's take an example. Is it cost benefit to keep a conventional refrigerator to maintain cold chain at sub-center? So this is a question which I am asking. Is it cost benefit to keep a refrigerator at sub-center? Right? This is my question. So I'll try to understand whether it is cost benefit, it is there or not. So let's try to see. Now I try to calculate what is the cost of refrigerator. So this is hypothetical example. So the cost of refrigerator per week which I have calculated, it comes around 50 rupees, right? And to run that refrigerator, you require electricity. So that is 10 rupees per week. So in totality, what we are spending 60 rupees per week if we buy a refrigerator. Now, should we buy, should we not? Let's see that. Now, if you don't buy the refrigerator, so our, sub-center we have A&M. So if we don't buy the refrigerator, the female health worker who is A&M has to travel for collecting the vaccines from the PHC, because we don't have PHC at the sub-center. So the traveling cost, I get 30 per week. Now if the traveling cost is 30 per week, so let's put 30 per week, right? And when she's traveling, she is not working. When she's traveling, she is not working. So that absence from work is costing rupees 40 rupees. So total cost when you don't buy a refrigerator, you are spending almost 70 rupees per week. Now you think, if you don't buy a refrigerator, you are spending 70 rupees. If you are buying a refrigerator, you are spending only 60 rupees. So can I say there is a benefit of 10 rupees per week if we buy a refrigerator? So if we are saving 10 rupees per week, we will be saving 520 rupees per year. So I can make a statement now, it is a cost benefit action to keep a refrigerator in a sub-center rather than female health worker coming to PHC to collect vaccine every time. So I have analyzed the benefit in terms of money. So it becomes cost benefit analysis. Simple, no? Now let's take cost effective analysis. Now money is not involved. Suppose I do a treatment of TB patient in hospital, or and I compare that cost with DOTS, no, DOTS strategy. Now we can say DOTS strategy is cost effective. Second, if I say, can we provide safe water supply, and we compare this with treatment of waterborne disease, definitely you will say provision of safe water supply is cost effective. So this is my cost effective analysis where money is not involved. So this is the difference between cost effective and cost benefit analysis. There is third also, cost accounting. As you see, students, accounting. So we have a program. Can we have a basic data on cost structure? So we have a program running. So what is the cost structure of the program? Three important purposes. When you are doing cost accounting, you want to keep a check on the cost control. You are planning an allocation of people and financial resources based on the money, based on the structure you have, cost structure you have for the program. You are trying to plan and allocate people and financial resources, and you're also trying to see the price of cost reimbursement. So actually, in nutshell, if I have to say, you are trying to account, now you're trying to give a structure, cost structure of a program. So that is my cost accounting. Then comes another one, input output analysis. Input. So we use human resource, manpower, we use money, we use material, we use time. So manpower, money, material and times are used. So can I say this is as an input? So whenever you are doing any health services, you require human resource, you require money, you require material, you require time. So this is my input. Now what is my output then? Output is when I'm using human resource, money, material, time in health services, what do I expect? I expect that how many cases are treated, how many lives saved, how are inoculations performed, vaccinations performed, inoculation performed. So input, based on that input, whether we have the same output or not. So input output table is kept and it is checked parallelly, which help us to understand that whether input is very much synchronized with the amount of output or not. If you are investing so much, input is very high and output is not that much, it means there is some problem. So this is called input output analysis. So in health system, the human resource, money, material, time is input, and number of cases treated, number of lives saved, number of activity performed, that becomes output. So this is called input output analysis. Then you have decision making. So there are 7 steps to effective decision making. Suppose you have to make a decision, students. So you know you have, whenever you decide something, so you try to identify the decision. For example, if I have to decide that I want to shift to European countries. I want to shift. So I am trying to identify the decision. Then to take that decision, you try to collect relevant information. Whether I have a suitable job there, whether the condition is conducive for me, whether I can get all the required prerequisite which is important for my relocation. So you try to gather relevant information. You identify the alternatives also. In case something goes wrong, what will be the alternative? You try to check the evidence behind that. You choose, and how many options? Suppose you have a European countries, you have option in Scandinavian countries, you have in Italy, France, any country, for example, I say. So you have multiple options. So you will be trying to weigh the evidence, which is best, which is not best. So you'll be trying to choose among alternatives. So step 1 is identify the decision which you want to take. Then carry or gather information regarding that. Do we have any alternatives? If we have, can we weigh the evidence? Which one is best, which one is not less best? Can we choose among them? When we have chosen among them, then you have to take action. And when you have taken action, students, maybe there is a possibility that you may regret after that. Oh, what I did, I should have not gone it. So you have to review your decision and its consequences. So simple, whenever you are deciding something, decision making, so you have to go through multiple things. You have to decide the decision, you have to weigh whether there are other alternatives or not, you have to carry the relevant informations, you have to take action, and you have to review it whether it can be correct, it may not be correct. If it is not correct, you have to review it. Correct mid-course correction has to be done. So ultimately, what is this? This is decision making. Now, we have discussed many things. Can we take few questions? The management technique which is more promising tool for application in health field. If I ask you which management technique is more promising in application in health field, you have four options, student: cost effective, cost benefit, cost accounting, input output. Now let's take one by one. All these things we have discussed. The most promising tool in health, the most important thing for me, if you ask me, is not money. It's not money oriented. So can I say cost benefit? No, I will not go with this. Cost accounting, it is just a structure of the program. Input output analysis also I will not go. I'll go with the option cost effective. Simple. If I can make sure a safe water supply in a community, that is solving my water related diseases, waterborne diseases, so that is cost effective. So I go with this management technique which is most promising in health field. So this will be my answer. So the answer is A. Now, most comprehensive indicator of cost effectiveness analysis. Now, the previous question was saying that, okay, the most promising health tool is management technique in health is cost effectiveness. Good, I agree. But how do you assess that? What is the indicator which will help us to assess the cost effectiveness? Number of life years gained, number of heart attack avoided, QALY gained, cost per life year gained. So if you see here, I will go with QALY gained. Now it is important to understand what is QALY. QALY is quality adjusted life years. I'll give you an example. You see how to understand QALY. So on x-axis, students, you have length of life in years. In y-axis, you have quality of life. Quality of life is measured between 0 and 1. 0 is almost dead and 1 is perfect health. Suppose I am suffering from any disease. So what should I do? I will go for the treatment. Suppose there is an old treatment which I am using. Now this old treatment is increasing my length of life by 2 years and is providing me quality of life of 0.75. So the quality of life is 0.75, length of life increase is 2 years. So what is QALY? QALY is quality of life, which is 2 year length of life plus multiplied by quality of life, which is 0.75. So I get my 1.5 QALY. Now I am the same person with same disease. There is a new treatment in the market now. This new treatment says that your length of life can increase by 6 years and your quality of life is now 0.8. So if I multiply 0.8 and 6, I get 4.8 QALY. Now, if I have to choose between old treatment and new treatment, definitely I'll go with new treatment because it has increased my QALY. My length of life has also increased and my quality of life has also increased. So what is the net gain in QALY? So old treatment 1.5 QALY, new treatment 4.8 QALY. So the net gain with the new treatment is 3.3 QALYs. So definitely I'll be going with new treatment. So this is the comprehensive indicator in terms of QALY which help us to understand cost effectiveness, students. Okay. Yeah, we have talked about this. Let's take another question. Economic monetary benefit of any program are compared with the cost incurred. Now, here the angle is not effectiveness, here the angle is money. So, the option answer becomes cost benefit analysis. So I'll go with option A, right? Now we have also a system analysis, student. So we have to understand system. Let's take medical education system, right? So if you try to understand medical education system, so what happened to a system? There is input. What is input in medical education system? Those who qualify NEET UG, they enter inside the medical system, medical education system. So all those students becomes input, right? So all those students who appeared for NEET UG, those who qualified, entered in the medical education system, they act as an input. Now what we do here, 4.5 years, an internship, 5.5 years, we teach them, we make them an Indian medical graduate. So that is processing. Your first year, second year, third year, final year. So processing, you're doing that processing. What is the output? The output is Indian medical graduate, right? So those students who entered in a medical education system goes output as an Indian medical graduate. And this is the system going on. So I just want to check whether the medical education system is performing correctly or not, or any changes can be done. So you keep on evaluating and you give feedback to input, process and output. And the output help us to evaluate whether the output is correct or not. Means okay, whether we are having a qualified Indian medical graduate or not, or some flaw is there in medical education system. The best example, if you see now, the conventional system has changed now. We have competency based medical education now. So this is what the traditional system had certain flaws. So there has been a change made, and now we are having competency based medical education. So you are doing what? System approach. You are trying to understand. You are trying to understand logically and trying to think what can be the solution of the problem. I'll give an example. So you are trying to do an analysis of a system. Take medical education only. So what will you do? If you are trying to analyze the medical education, so first you will the already existing system which was there before, already existing system was there. You try to identify how it works. Then what you do, you understand what the existing system is doing, how the system works, how the the student enters, how they are taught for 4.5 years and 5.5 years, and how they go out. So when you have understood that, you are trying to understand the need of the users. You innovate, suggest alternative strategy. Is there some flaws? So can you suggest some alternate strategy? When you are suggesting new strategy, decide on what the new system should be doing. So you should also decide what the new one or the alternative strategy which you have suggested, how that will be working and how that will function. How will you analyze that function? It is not that change is every time correct. You are doing a system analysis, you found certain flaws, you are coming with an alternate strategy. But you have to also assess that alternate strategy, how it works, how it functions, and you have to analyze that function. Then only you will be able to say whether the alternative strategy is better than the old one. There is a possibility that the alternative strategy doesn't work, and if it doesn't work, then it's a problem, right? Then the another type of study is model or simulation study. Very easy to understand. Please assess the current situation. Based on current situation, can you predict the future? Based on current situation, can we predict the future or performance of the process? That is my simulation study, right? So it uses different mathematical, statistical or analytical methods. So this is my simulation study or modeling, right? The most important one comes last is, and others are also there, network analysis, students. Please try to understand this. This is a technique which is used for planning, management and control of projects. So there is a project, for example, any project which you are a part of. So this planning, management and control, how can you do that is best done by network analysis. And the best way of understanding is, so when you do a project, multiple activities will be done right from the start till end. So can you give a logical sequence to each of the activity? You are starting the project, you will be ending the project. So in between you will be doing different steps. So can you give a logical sequence to start and end of the project? Now, what does that mean? So you are breaking each steps into small, each from start and end, you're breaking the program into individual jobs, right? And then you are trying to estimate the duration, what will be the resource requirement, and based on that you are reallocating money and other resources. So can we understand with a graph? Now you see all this rectangle box 1, 2, 3, 4, 5, 6, 7, 8, 9, 11 it is shown. These are rectangle nodes. These are called nodes, right? And they represents a milestone. Then you have an arrow. You see this arrow and then you have this arrow. These are directional arrow. And if you see this arrow and this arrow, so these are sequential arrow, means after 1, 2 a milestone will reach with this arrow. After 2 will reach to 4 milestone with this arrow. So this programming arrow is dependent on this. So these are dependent activity. Now if I say this arrow, you see here, diverging arrows from 1 to 2 and 1 to 3. So 1 to 2 and 1 to 3 are concurrent activity. They can go simultaneously. No, you can move this side also, you can move this side also. So we have dependent, we have independent also. So they are diverging, they are not dependent on this. But if I say 1 to 2 and from 2 to 4, so from 2 to 4 we will only reach when we have reached from 1 to 2. So 1, 2, 4, 8, 9, all these are milestones, and this is the path which we follow. So you can see there are multiple arrows. From 3 we are going to 5, then we are going to 4. So this is the network we have created, and we are reaching at the end, which is 11. There is a dotted line also you see here. These indicate dependent tasks, but they don't require any resources. If you see all other places where you require programming, create a schedule, test code, test system, so you require resources. But in the dotted lines, you don't require any resources. When the entire project is broken down into individual jobs and you start plotting it, create this network. This is called Program Evaluation Review Technique. PERT, you must have heard n number of times. PERT, it's Program Evaluation Review Technique. So what I have done, the project, I have broken that project into small activities. I have given a direction, which activity is dependent on which activity can be conducted concurrently, and I have plotted it and I got this graph, right? So this is Program Evaluation Review Technique. Now, just I have taken a simple one. Now if you see, this is the start, this is the end, right? And this is the project which starts here and here. And you see activity 1, 2, 3, 4, 5, it is written, and then these are the activities, and we have arrows also. And the numbers, can we take this number as months, right? 3 months, 7, so duration. Now try to understand how many paths we have, students, here. So if I see it starts, let's start. So I go to activity 1, then I can reach to activity 3, activity 4, and finish, right? So I can say 1, start, 1, 3, 4, finish is my one path. Let's take the second path. So start, activity 2, activity, then this goes this side also. So which is activity 3, 4, and finish. So this is my second path. The third path is start, activity 2, activity 5, and finish. So these are the 3 paths, students. In these 3 paths, which path takes the longest duration? So if I add this, if I consider these numbers as duration, so if I say okay 1 3 4 5 1 3 4, let's try to take this path and how much time we are taking. So 3 7 and 2, 7 3 10 plus 12, so we are taking 12 months. If I take 2 3 4, so this is 5, this 7 and 2, 7 5 12 to 14, so 14 months. If I take this path, so 5 plus 4 is 9 months. So my S2345 is the longest path, and the longest path, student, is called critical path method, CPM. Why this is critical? Because if this project gets delayed, if this path gets delayed, the entire project gets delayed. So CPM, critical path method, when you are plotting, when you are trying to formulate this management technique, which is called PERT, Program Evaluation Review Technique, where what you have done, the project you have divided into small activities, and you have given a network to all the activities which is required. So that is PERT. In that, how many paths do you have? Among those paths, the path which is longest is the critical path method. If that gets delayed, the entire project gets delayed, right? So this is network analysis. It has got PERT and CPM. Now see the questions on this too. There are 2 or 3 questions. Time taken for any project is estimated by. Network analysis, you have seen there were many activities, time was given, so time taken for any project is best analyzed or estimated by network analysis. Now let's take the second one. PERT, Program Evaluation Review Technique, is a type of network analysis. Simple, right? Let's take the next question. All are true regarding critical path method except, so they are asking you CPM, what is not correct. Now, is a part of input output analysis? This is wrong. This is not a part of critical path method. Visualize in graphical representation of all event activities carried out? Correct. This is a part of CPM. Is the longest part? Correct. Any delay in CP, critical path, delays the whole project? Correct. Just now we have read this. We have seen the graphical representation. We have also said the longest path is the critical path, and if that gets delayed, the entire project gets delayed. So this is CPM. So the answer here, because they are asking you except, so the answer is a part of input output analysis. So I'll stop here, students. I hope the management and its technique with few questions also I have taken just to ensure that how questions are asked and what understanding you should make, so that you can answer the question also, you can understand the topic also with ease, and you remember this management techniques for long term. Okay. With that note, students, thank you for watching. Take care. Bye bye.